is anxiety. Anxiety is like having a worry bug that just won't leave you alone. It is the feeling of nervousness or unease about something that might happen in the future, even if it's not happening right now. Anxiety is a common emotion that everyone experiences from time to time. It is a normal human response to stress and can help motivate us to act or prepare for challenges. However, when anxiety becomes excessive or persistent, it can interfere with our daily life and may indicate an anxiety disorder.
Next is about various types of anxiety and how they manifest. Anxiety is a natural part of the human experience, but understanding its different facets can help us support those who may be struggling. Firstly is generalized anxiety disorder, or GID. GID involves persistent and excessive worry about various aspects of life such as health, work, family, or finances. Secondly is social anxiety disorder. Social anxiety is characterized by an intense fear of social situations, often driven by a fear of being judged, embarrassed, or humiliated. Thirdly is panic disorder. Panic disorder involves recurrent and unexpected panic attacks accompanied by a sense of impending doom and physical symptoms like chest pain and shortness of breath. Fourth is specific phobias. Specific phobias are intense fear of specific objects, situations, or activities that lead to avoidance behaviors. Fifth is obsession compulsive disorder or OCD. OCD is characterized by persistent intrusive thoughts and repetitive behaviors or mental acts performed to alleviate anxiety. And lastly, agoraphobia. Agoraphobia involves a fear of situations or places where escape might be difficult or help unavailable, leading to avoidance of such spaces.
Now I want to explain about the symptom of anxiety. First, physical symptom. Physical symptom of anxiety are the bodily side resulting from emotional pressure, like a fast heartbeat, shallow breathing, sweating, stomach discomfort, head dance, and muscle tension.
I would like to talk about the cognitive and physiology symptom. Anxiety not only increase your heart rate and narrow your muscle, but it also indicate doubts and blocks your cognitive processes. The cognitive symptoms such as poor focus, intrusive worries, and problem with the memory can be equally, if not more, unpleasant than physical symptoms. Now, what are physiological symptoms? Physiological symptoms are mental and emotional experience that can affect your thoughts, feeling, and behavior. They can range from mild and occasional to severe and debilitating. Some common physiological symptoms include mood changes, feeling sad, anxious, or angry more often than usual. Changes in thinking, having difficulty concentrating, remembering things, or making decisions. Changes in behavior, withdrawing from social activities, neglecting responsibilities, or engaging in self-destructive behavior.
To address these symptoms, deep breathing technique, exercise, good health practice, as well as counseling or therapy can be helpful. Engaging in stress management techniques such as meditation, yoga, and or calming activities can also be beneficial.
One of the triggers that can worsen someone's anxiety is genetic. By genetic, it doesn't mean that a person have anxiety genes, but rather it means that a variety of genes that interact with one another to predispose someone's anxiety. Then, through a biochemical process which is called DNA methylation, it can alter the expressions of our genes and subsequently worsen our anxiety. However, this biochemical is not only affected by our genes, it also affected by the environment, which means that how we eat, how we sleep, the air we breathe, and the stress that we face is the things that can alter the expressions of our genes. Therefore, in order to lessen someone's anxiety is by removing them from stressful events, or by making sure that they have enough sleep. Next is traumatic experiences. Traumatic experiences can trigger someone's anxiety because traumatic events can create a perception that one's life is in danger. For example, in cases of abuse or neglect during childhood, the effects of trauma can persist into adulthood and might cause anxiety, like separation anxiety. For example, if a person that experiences neglect during their childhood because of various of reasons, like for example because their parents are divorced and they are being neglected by their divorced parents, this child might experience anxiety, and especially separation anxiety. And during their adulthood, whenever they feel like they being neglected by someone that they are close with, this can trigger their anxiety during that time.
And next, anxiety can be influenced by personality features as well. Perfectionism, excessive worry, and a tendency to be overly self-critical have all been linked to an increased chance of developing anxiety. Thyroid issues, heart illness, and respiratory conditions, for example, can cause or intensify anxiety symptoms. For the substance misuse, such as excessive alcohol or drug use, can contribute to anxiety disorders or worsen existing anxiety symptoms. And then after that, anxiety can also be exacerbated by environmental variables, exposure to violence, social isolation, or living in unstable or a chaotic environment can all have an adverse effect on a person's mental health, and it will raise their risk of developing anxiety. It is crucial to keep in mind that different people will experience anxiety at different times, and that these triggers may involve a number of interrelated circumstances. So, anyone that feeling anxiety should seek professional assistance for a thorough assessment and a suitable treatment for themselves. So, that's all from me. Thank you.